HIV virus and AIDS. HIV virus is a retrovirus. A retrovirus is a virus that is capable of inserting a copy of its RNA into the DNA of host cell, thus changing the genome of that cell. It's a positive single-stranded RNA virus, but it is also known as sense-strand RNA virus. Positive strand RNA means that this RNA is similar to messenger RNA and is capable of being translated by the host cell into proteins. In case of replication, the positive stranded RNA virus have to create a negative strand intermediate before starting replication. It is a diploid RNA. That means it has two molecules of RNA. It doesn't have a single strand, there are two separate RNA strands inside it. It is enveloped. It belongs to lentivirus subgroup of retroviruses family. That is, it causes slow infections with long incubation periods, going to years. Since its target is human T cell, so it is a human T cell lymphotrophic virus. There is another virus who is a human T cell lymphotrophic virus, that is human T cell leukemia virus. So, human T cell leukemia virus and HIV virus are two important human T cell lymphotrophic viruses. There are two types of HIV viruses, HIV-1 and HIV-2. They are present in specific locations, especially HIV-2. HIV-2 is present only in West Africa, while HIV-1 is found in the rest of the world. HIV-2 is less aggressive than HIV-1. HIV virus has three special enzymes: reverse transcriptase, integrase, and protease. Reverse transcriptase. It is an RNA-dependent RNA polymerase. Once the virus enters the cell, this enzyme converts HIV RNA into HIV DNA. This is the DNA that is capable of going inside the nucleus and combines with the cell's genetic material. The second enzyme is integrase. Integrase is the enzyme that inserts the DNA of HIV virus into the DNA of the host cell, the second step. The third enzyme is the protease. Protease cuts up the larger precursor proteins into smaller proteins. These smaller proteins combine with HIV's genetic material to form a new virus. Structure of HIV virus. HIV virus has a cylinder-shaped core, which is a type D core. Its enzymes are found within the nucleocapsid. The core is surrounded by an envelope containing viral-specific glycoproteins, that is glycoprotein 120 and glycoprotein 41. Its genome is composed of two single-stranded RNA molecules of positive polarity. That is why it is a diploid RNA virus. This is the structure of HIV virus. We will go from outside to inside. On the outside is the envelope that has the glycoproteins 120 and 41 embedded in the envelope, and so this is the envelope glycoprotein complex. On the inside you can see the rod-shaped capsule. Inside the rod-shaped capsule is the two strands of RNA, which are the positive sense RNA strands. The RNA strands are covered by nucleocapsid. You can see the enzymes floating with the three special enzymes: reverse transcriptase, integrase, and protease. Genes of HIV virus and the special genes which are used during replication. There are three typical retroviral genes, which are GAG gene, POL gene, and ENV gene. There are 6 regulatory genes, out of which 2 are involved in replication, which are TAD gene and REV gene. Other 4 are not involved and therefore they are called accessory genes, which include NEF gene, VIF gene, VPR gene, and VPU gene. Now we will discuss the 3 typical genes, the proteins encoded by those genes, and the function of those proteins. First is the GAG gene. GAG gene creates the envelope proteins, which are P24, P17, and P7. P24 is the capsid protein, P17 is the matrix protein, and P7 is the core nucleocapsid protein. The second gene is the POL gene. POL gene creates the enzymes, the 3 special enzymes that we have discussed. The 3 enzymes are reverse transcriptase, integrase, and protease. The third gene is the ENV gene. ENV gene creates the glycoproteins. Glycoproteins are responsible for the targeting of the target, for binding to the target, for entry into the target. GP120 and GP41. You have seen in the structure, they are embedded in the envelope, creating the envelope glycoprotein complex. GP120 binds the CD4 and the chemokine receptors, and GP41 is responsible for the fusion of virus to the host cell. Classification of HIV virus based on GP120 gene. Based on the difference in the base sequence of the glycoprotein 120 gene, there are many different types of HIV viruses. This classification is known as Clades. This classification is based on difference in base sequence of GP120 gene as we have discussed. For example, B-type clade and E-type clade. B-type clade is common in North America. It mostly attacks mononuclear cells. Its GP120 is specific to them and mostly passed via anal sex. E-type clade infects female genital tract cells and mostly passed via vaginal sex. Mode of transmission of HIV virus. There are 4 ways. First is sexual way. It could be from man to man. It could be heterosexual sex or vaginal sex. It could be oral sex. Second mode of transmission is parenteral. That includes IV transmission, blood transfusion, IV drugs use. That includes dirty syringes. Third pathway is vertical transmission from mother to child during pregnancy. It can occur during pregnancy or during childbirth. 80% of transmission occurs during childbirth. It also passes via breastfeeding. So, mother is advised not to breastfeed the baby. So, in summary, the infective fluids are blood, breast milk, semen, and vaginal fluid. Targets of HIV virus. It depends upon its specificity of glycoprotein 120, which is embedded in its envelope. So, depending upon the glycoprotein 120 on its envelope, HIV virus attaches to 2 targets on cell surface before fusion. So, there are 2 steps before fusion to the cell. First, the initial target binding, which is the CD4 receptor. This receptor is found on helper T cells, mononuclear cells, and macrophages. After binding to the initial target, the glycoprotein 120 binds to the second target, which is the chemokine receptor. The chemokine receptor is different. It is CCR5 receptor in macrophages and CXCR4 receptor on helper T cells. So, this second target binding is the one that determines whether the HIV virus attacks macrophages or whether the HIV virus attacks helper T cells. Mechanism of action of HIV virus. The 7 stages of HIV life cycle are binding, fusion, reverse transcription, integration, replication, assembly, and budding. The following diagram shows the life cycle of HIV. We will discuss the 7 stages. The first stage is the binding stage, also known as attachment stage. HIV binds to the receptors on the surface of a CD4 cell. These receptors include initial target, which is the CD4 receptor, and the second target, chemokine receptor. The second stage is the fusion stage. During this stage, the HIV envelope and the CD4 cell membrane fuse via glycoprotein 41, which allows the HIV to enter the CD4 cell. Third stage is the reverse transcription. Once inside the CD4 cell, HIV releases and uses reverse transcriptase to convert its genetic material RNA to DNA. The conversion of RNA to DNA allows the HIV to enter the CD4 cell nucleus and combine with the cell's genetic material, the DNA of the cell. Fourth stage is the integration. Once the DNA of the HIV virus goes inside the nucleus, it releases integrase. HIV uses integrase to insert its viral DNA into DNA of the host cell. The fifth step is the replication. Once integrated into the CD4 DNA, HIV begins to use the machinery of the cell to make long chains of HIV proteins. The protein chains are the building blocks for more HIV. Stage 6 is assembly. Now the proteins have been formed. New HIV proteins and HIV RNA move to surface of cell and assemble into immature HIV, which is non-infectious. The last stage is budding. Newly formed immature HIV pushes itself outside of the host cell. The new HIV releases then protease. Protease breaks up the long protein chains of the immature virus. After breaking of the protein chains, the immature virus becomes a mature, infectious virus. An important note. Window period of HIV. It is a period during early phase of infection. During this period, HIV antigens are present in blood. only HIV antigens are present. Serological conversion has not yet occurred, antibodies are not formed. So antibodies are not detectable in blood. During this period, if a screening test is done for antibodies, it will give a false test report. That is why blood banks now test for P24 antigens, which are the capsid proteins, in an effort to detect HIV antigens if the person is newly infected and has yet to form antibodies. 4 phases of the typical course of HIV infection. If left untreated, HIV goes through the following stages. Primary infection, also known as prodrome stage or seroconversion illness. Then asymptomatic stage, mild asymptomatic stage, and the late stage, when the patient has acquired immunodeficiency syndrome. First stage is the primary infection. It usually occurs 2 to 6 weeks after exposure, and it lasts from 3 days to 2 weeks. Its clinical features are of mononucleosis like symptoms in which the patient has flu, fever, pain, body pain, and other things, plus cervical lymphadenopathy. It has high plasma HIV RNA levels, and its CD4 count is 300 to 400 cells per millimeter cube. Second stage is the asymptomatic stage. It is category A disease in CDC classification. It is a latent phase of disease. Patient is seropositive, but there are no symptoms. This is the longest phase, lasting 4 to 7 years. A large amount of HIV is being produced and sequestrated inside the lymph node cells. That is why viremia is low. Because it is confined inside the lymph node, it is growing inside the lymph node. So there could be lymphadenopathy noticed in some patients, but there will be no viremia. It won't be found in the blood. That is why we could get a false test and patient may be infected in real life. During this period, the virus itself is not in the latent period, it is functioning. That is why CD4 counts are normal. That's why it is an asymptomatic stage, because CD4 counts aren't decreasing at a rapid phase. CD4 cells decline at the rate of 50 to 150 cells per year. The next stage is the mildly symptomatic stage. It is category B disease in CDC classification. It is a pre-AIDS stage. It gives first evidence of immune system dysfunction, and its duration is 1 to 3 years. Due to dysfunction and weakened immune system, we have greater risk of developing infections. But these diseases are not AIDS defining diseases. The last stage is the AIDS, Acquired Immunodeficiency Syndrome. It is category C disease in CDC classification. It is defined by HIV with any of the following 3 criteria. It could be either CD4 count less than 200 cells per millimeter cube, or opportunistic infections, or malignancy. So HIV with any of these 3 conditions, any one of these 3 conditions fulfill the criteria of AIDS. It is marked immune suppression, leading to disseminated opportunistic disease and malignancy. AIDS defining diseases. These are the opportunistic infections that could occur only in AIDS patients. We will discuss the site of infection, the disease that occurs at that site, and the organism causing that disease. The first site is the lung. It could be pneumonia, and pneumonia is caused by Pneumocystis jirovecii or cytomegalovirus. The second disease in lungs could be TB, tuberculosis, which is caused by Mycobacterium tuberculosis. Second site is mouth. In mouth, it could be either thrush caused by Candida albicans, or hairy leukoplakia caused by Epstein-Barr virus, or ulcers caused by herpes simplex 1 or Histoplasma capsulatum. Third site is esophagus. Thrush caused by Candida albicans, or esophagitis caused by herpes simplex 1 or cytomegalovirus. Intestinal tract. Diarrhea, most commonly caused by Cryptosporidium parvum. Then later it could be either caused by Giardia lamblia, Salmonella, Shigella, or cytomegalovirus. Central nervous system. Brain abscess caused by Toxoplasma gondii. Progressive multifocal leukoencephalopathy caused by JC virus. Or primary CNS lymphoma caused by Epstein-Barr virus. In eye, retinitis occurs by cytomegalovirus. Meninges could get meningitis by Cryptococcus neoformans. Skin. First disease is Kaposi sarcoma. Kaposi sarcoma is caused by human herpes virus 8. Second, zoster, caused by varicella zoster virus. Third, subcutaneous nodules, caused by Cryptococcus neoformans that cause meningitis. The next side is the reticuloendothelial system, and the disease is lymphadenopathy or splenomegaly. It is caused by Mycobacterium avium complex or Epstein-Barr virus. Some of these opportunistic infections could be avoided by AIDS patients if they take some drugs. First drug is trimethoprim sulfamethoxazole. It prevents pneumocystis pneumonia and toxoplasmosis. Second drug is fluconazole that prevents Cryptococcus neoformans. Third is clotrimazole that prevents Candida albicans. Fourth is ganciclovir that prevents cytomegalovirus retinitis. And the last one is azithromycin or clarithromycin. It prevents Mycobacterium avium complex infection. Diagnosis of AIDS. The first two tests for antigen of virus and the last test is for antibodies of virus. First test is PCR viral RNA, viral load test. For acute HIV infection, to check high levels of viremia, it checks for HIV antigens. Second test is P24 antigen assay, that is the capsid protein. It is less sensitive test. It is alternative to above. The last test is test for seroconversion, that is it is done to find antibodies, and we know antibodies are formed later after infection, 3 to 7 weeks after infection. So following tests used for this. First test is ELISA test. It looks for HIV antibodies, and when the test becomes positive, we confirm it with a Western blot test. Diagnosis of HIV in neonates. ELISA and Western blot test are positive in neonates of an HIV positive mother, whether the neonates are infected or not. Why? Because it is positive because maternal anti-HIV antibodies have passed to baby and given him passive immunity. So, test will be false positive, and we will not know whether these antibodies are formed by the baby or are passed from the mother to the baby. So, to confirm HIV infection in babies, we do HIV RNA and HIV DNA nucleic acid amplification tests. Drugs used for treatment of HIV infection. Following types of drugs are used. Number 1. Reverse transcriptase inhibitors. They could either be nucleoside reverse transcriptase inhibitors that competitively inhibit reverse transcriptase, or non-nucleoside reverse transcriptase inhibitors that non-competitively inhibit reverse transcriptase. The second type is protease inhibitors that inhibit protease. Third type is integrase inhibitors that inhibit integration into the host DNA. The last type is entry inhibitors that could either be binding inhibitors. They deal with GP120 inhibition, or they could either be fusion inhibitors. They deal with GP41 inhibition. Now we will discuss the administration technique of these drugs. They are given in combination therapy. Combination therapy is always better than monotherapy because this virus can develop resistance and mutations easily. So a triple drug regimen called highly active antiretroviral therapy, HART, is used.